Face of terminal illness, how would you want your family to see you in your final moments? If you had a choice, would you want your family to remember you as a healthy, energetic, and happy person, or as a terminally ill patient in pain, weakened with suffering and despair? Marion Frederick was 72 years of age, diagnosed with an incurable disease called Lou Gehrig's disease, also known as amyotrophic lateral sclerosis. She was also my great-great-aunt. Lou Gehrig's disease caused the deterioration of nerve cells, which then reduces functionality in the muscles and impacts physical function, leading to death. Unable to bear the pain of her disease, my aunt received treatment from Dr. Jack Kevorkian, the first doctor to perform physician-assisted suicide. Countless individuals all over the United States have been diagnosed with terminal diseases that give the individual discomfort, pain, and sorrow, and not being able to live a healthy life. According to the Center for Disease Control and Prevention, for the year 2017 in the United States, there were 2,712,630 deaths, and unfortunately in that number, 595,930 individuals had cancer, 110,561 individuals had Alzheimer's disease, two diseases that do not have cures, and both are terminal illnesses. Physician-assisted suicide allows the individual with a terminal illness to pass on in peace, knowing their families carry on the memories of liveliness, passion, and happiness. According to Robert Perlman, MD, Professor of Medicine in the Departments of Medicine, Medical History and Ethics and Health Services, University of Washington, and Helene Starks, PhD, Assistant Professor in the Department of Medical History and Ethics at the University of Washington, Seattle, popular explanations for physician-assisted death include inadequate treatment for pain or other symptoms, depression, hopelessness, and socioeconomic stressor, such as concerns about the burden of increasing dependency on other members of the family and the economic hardship associated with the costs of health care. These reasons, among many, prove that physician-assisted suicide should be legalized throughout the United States so that individuals are able to make their own decisions concerning their death. In addressing the legalization of physician-assisted suicide, first, let's discuss the situation if physician-assisted suicide is not an option for a terminally ill patient. If one does not have the option of physician-assisted suicide, the terminally ill patient resides in hospice care, designed to give supportive care to people in the final phase of a terminal illness, focusing on comfort with no cure. According to research in 2014, Medicare spent $15.1 billion on hospice care, on average of $11,393 per hospice beneficiary. Of course, an individual's death should not be profited from. However, the choice of physician-assisted suicide allows the individual to not only save thousands of dollars on hospice care for their family, but the choice allows the individual to rest in peace without the pain and suffering of their disease. However, when discussing the choice of physician-assisted suicide, let me emphasize there is not a price placed on life. Merely, there can be a potential solution to the issue that a terminally ill patient can have the option to end their life earlier than their disease will take them to end their pain. The Death with Dignity Act was passed when legalizing physician-assisted suicide in California, Colorado, District of Columbia, Hawaii, Montana, Oregon, Vermont, and Washington. The Death with Dignity Act allows terminally ill individuals to end their lives through the voluntary self-administration of lethal medications expressly prescribed by a physician for that purpose. Physician-assisted suicide follows a strict and specific process that is only open to terminally ill patients at least 18 years of age to make sure the terminally ill individual is protected from abuse or persuaded to follow through with the process. There are requirements in place, such as the individual must be an adult resident of a state where such law is in effect. The individual must be mentally competent, i.e. capable of making and communicating one's own healthcare decisions. The individual must be diagnosed with a terminal illness that will lead to death within 6 months. 2 physicians must confirm the diagnosis. Each physician must be licensed by the state to practice medicine and certified to prescribe medications, and only the patient can make the request for medication in person. These strict guidelines for the process of physician-assisted suicide make it possible for terminally ill individuals to safely pass on without risk or inhibitions. Physician-assisted suicide should be legalized in every state to make sure every terminally ill patient has the option to consider if they want to end their life in peace, saving them from the cost of hospice care and the suffering of their illness. Brittany Maynard, 29 years of age, was diagnosed with brain cancer and stated, "After months of research, my family and I reached a heartbreaking conclusion. There's no treatment that would save my life, and the recommended treatments would have destroyed the time I had left." She considered all of her options as her brain tumor affected her daily life. Brittany Maynard stated, "I considered passing away in hospice care at my San Francisco Bay Area home. But even with palliative medication, I could develop potentially morphine-resistant pain and suffer personality changes and verbal, cognitive, and motor loss of virtually any kind." Brittany Maynard made the choice to go to Oregon, where the Death with Dignity Act was passed, and indicated, "I am not suicidal. If I were, I would have consumed that medication long ago. I do not want to die, but I am dying, and I want to die on my own terms." Brittany Maynard strongly advocated for physician-assisted suicide, stating, "Who's the right to tell me that I don't deserve this choice? That I deserve to suffer for weeks or months in tremendous amounts of physical and emotional pain? Why should anyone have the right to make that choice for me?" She decided to stay strong even though her life was at an end, sharing with the world her story behind physician-assisted suicide, and said, "Having this choice at the end of my life has become incredibly important. It has given me a sense of peace during a tumultuous time that otherwise would be dominated by fear, uncertainty, and pain." Physician-assisted suicide is never an easy choice to make when one's loved one is terminally ill. However, it is that love that allows one to want to see the other with happiness and comfort. Physician-assisted suicide should be legalized to allow a terminally ill patient the choice to die on their own terms. In doing so, they are able to pass on with peace, knowing that their disease will not consume them at the very end. Physician-assisted suicide should be legalized to not only give the terminally ill patient a choice to die on their own terms, but to also have the choice to not spend thousands of dollars on hospice care when there is not a cure available for the patient. Physician-assisted suicide should be legalized because depriving an individual's right to have a choice in how they die is inhumane.